Hemorrhoids during pregnancy can be a real pain in the butt, pun intended, and today I'll share 8 tips to manage them, and that includes some techniques you will never hear about anywhere else on the internet, so keep watching until the end. But before we get started, make sure you subscribe to my channel so you don't miss any of my future videos for a healthy pelvis throughout your maternity journey. A hemorrhoid is basically a blood vessel sticking out of your bum area. There can be different reasons why they happen in pregnancy, but most commonly it's caused by constipation and increased pressure on the pelvis from your growing baby. Hemorrhoids can be either internal or external, or both if you're lucky. So internal hemorrhoids are located inside the rectum. That means you won't be able to see or touch them, whereas external hemorrhoids are located outside of the rectum, so just by the anus, and you can normally see and touch them. The main symptoms are pain and bleeding during bowel movement, and in the worst case, when they're very swollen and inflamed, you may also feel pressure and pain in the anus area throughout the day or when you're sitting. The tips that I'm about to share with you are to help with active hemorrhoids, meaning they are causing you symptoms at the moment. But if your hemorrhoids are simply there but they're not causing you any symptoms, you will just want to stay on top of my recommendations to avoid constipation in pregnancy, which I will link in the description below. Alright, so let's get started with tip number 1, keep your stool soft. If you're dealing with constipation, it for sure adds pressure to your rectum every time you're trying to push that hard stool out, right? So your hemorrhoids are going to be flared up right away because they're just little blood vessels and they're very sensitive to pressure. So constipation is always the very first thing I want to fix with my clients who have hemorrhoids because it's often the root cause of their condition. So if you look at the Bristol stool chart here, we want to aim for a stool that looks like a nice soft sausage with no crack. If you're not sure where to start from to fix your constipation in pregnancy, watch my video with my top 10 tips for constipation. I will link it in the description below. Tip number 2 is icing. When hemorrhoids are very swollen and painful and you feel like every bowel movement is basically like razor blades through your bum hole, I highly recommend icing the area to decrease inflammation. Now you may wonder, how the heck will I ice my anus, right? Well, other people have figured this out for you and invented the one and only Anurex. So the Anurex is a small cooling device the size of my pinky finger that you can insert in your rectum with a bit of lubricant and leave it there for 5 to 10 minutes in order to decrease inflammation. I know this does not sound fun, but once you try it, believe me, you'll realize how much you've missed it all this time. The lubricant is provided in the box, but you can really use any kind of lubricant you have, like a water-based lubricant, for example. And all you have to do after using it is to clean it, put it in a container, and put it in your freezer so it's ready for the next use. It has literally saved some of my clients' lives. One lady said she would have never made it through her pregnancy and postpartum without it. So quite a testimonial, eh? But I mean, if you wanted, you could also use a cold gel pack and sit on it for a while. But I'm just saying it won't be as specific as the Anurex to ice the rectum. And if you are dealing with internal hemorrhoids, you really want to have something that will get in there, right, in the rectum in order to do an effective job. Now, how much do you need to use it? It will really depend on the person and your symptoms, but I would say if bowel movements are really painful, I would use it after. And if you know when you're gonna go to the bathroom for number 2, you could also use it before to reduce the size of your hemorrhoids before there's any stool that goes through the canal. If you have symptoms throughout the day, if you're sitting and it's feeling like a lot of pressure and pain around the anus, you could also use it a few times a day to reduce symptoms. So it really depends. It'll be likely a little bit of trial and error, but I'm sure you'll find your groove with it. Tip number 3 is anti-inflammatory cream. This is something you can discuss with your healthcare provider, but there are anti-inflammatory creams out there to reduce inflammation from hemorrhoids. And I got lots of good comments about Proctofoam, which is under prescription. But again, this is something you should ask your doctor about just to make sure it's safe for you to use in pregnancy. I've got mixed reviews about off-the-shelf options, so I tend to recommend to my clients to simply just chat with their physician and see if they can get something more effective under prescription. Tip number 4 is release the anal sphincter. Okay, I'll likely be the first person and the only person ever showing you this magic trick to manage hemorrhoids, but honestly, it works like a charm, and I have taught it to so many of my clients who said that it's a game changer for them, and now they can actually manage their hemorrhoids whenever they flare up. So I wanted to share this with you. So there's a little muscle here around your anus called the external anal sphincter. And that sphincter can really get tight, especially when you've been dealing with hemorrhoids and painful bowel movement for a long time. Because what happens basically is you're developing that protection response to tighten this muscle from pain rather than relaxing it. Which is what you should be doing during bowel movement, is to relax it and make sure that there's enough space. So it's super common in clinic that I find a tight external anal sphincter in my patients with a history of painful bowel movement, and it just does not help because the tighter that muscle is and the less space there is for that stool to come through when you have a bowel movement. So what happens is all the little blood vessels around the anus are taking the hit for that lack of space and pop out. And there you go, you have hemorrhoids, right? So what you'll do to release that muscle is you're going to put your thumb inside the vagina, and your index finger is going to be on the top part of the anus externally, so on the perineum, on that area here between your vagina and your anus. And you're going to massage that muscle gently, kind of doing a rolling motion. And you can also go a little bit to the right here and a little bit to the left to just address this whole area. And at the same time, you want to think of your anus melting and letting go. Because if you're squeezing that muscle as you're massaging it, as with any massage, it's not going to be effective. So in terms of the position to use when you're doing the massage, I like to do it on the side with my knees up, especially when the bump is bigger. But otherwise, you could also be semi-sitting and maybe using a mirror or your phone in selfie mode to just see what you're doing and what you're actually massaging. But once you're comfortable with the technique, you can really use any position for as long as you can be relaxed. Some of my clients even do it in the shower with a foot up on the tub. So really just do what works best for you. You'll want to do this massage about 2 to 3 minutes every day until your symptoms resolve, and you can do it again every time you experience a flare-up. So that's what's wonderful about that technique. Once you have it in your toolbox, you can reuse it over and over again. Tip number 5 is relax your pelvic floor during bowel movement. So your pelvic floor here, which is like the red muscles on that model, is around the anus and the rectum, right? And the anal sphincter is part of that pelvic floor. So it's super easy to get into the pattern of tightening the pelvic floor and anus during bowel movement as a protection response from the pain that you've been experiencing over and over again. And that makes sense, right? We all want to protect ourselves against the pain, but the thing is that protection response is counterproductive for your hemorrhoids and for them to heal, because when you're squeezing here, you're actually reducing the space for your stool to come through, and it's hurting your hemorrhoids even more and flaring them up. So instead, what you need to think of is letting go of the tensions around your anus and pelvic floor while your stool comes out. Think of your pelvic floor and anus blooming as a flower, melting, softening, whatever you want to think about, but letting go. And if you're having a hard time connecting with that idea of letting go of your pelvic floor, I can coach you through all of it step by step in my online program. My goal is to help pregnant mamas be comfortable in their pelvis throughout their pregnancy and help them prepare for an easy delivery and postpartum recovery. So if you're into that, you can apply on a free discovery call with me in the description below. Tip number 6 is breathe it out. So what I mean by that is when you have a bowel movement, avoid blocking your breath and pushing your stool out because it adds more pressure to the area and your hemorrhoids will just flare up even more. So instead, what you want to do is let your stool come out on its own. Don't even push it and breathe through it. But this is going to be much easier to do if you have a soft stool, right? So that comes back to my tip number 1 to address constipation first. And then once you have that nice soft stool, it's going to be way easier to apply tip number 6, which is breathing it out. Tip number 7 is try a belly band. Like I said in my introduction, pressure from your growing baby on the pelvis can absolutely increase the likelihood of hemorrhoids. So especially if you're in your late 2nd or 3rd trimester, you may want to try using a belly band and see if lifting that weight off the pelvis helps improve the circulation in this area. So I'll put a video about my belly bands review in the description below if you want to look at different options. And tip number 8 is see a pelvic health physiotherapist. I know this is something that comes up a lot on my channel, but you know what? If you've tried all of these tips and you're still having lots of pain and issues with your hemorrhoids, I would consult with a pelvic health physiotherapist to assess for pelvic floor tensions, because we've seen already in the previous tips that having a tense, tight pelvic floor can increase the pressure around the anus and rectum and therefore can cause hemorrhoids. So I will link some of my videos to address tight pelvic floor tensions in the description below if you want to check out some DIY techniques meanwhile, but I would strongly encourage to consult with a professional as well. All right, those were my tips. I hope to chat with you over a discovery call soon to help you further in your journey, and thanks for watching.